Alberta Health Services. Healthy Albertans, healthy communities, together.
Good morning, everyone. I'm David Wyant, Chair of the Alberta Health Services Board, and would like to welcome everyone to this physically distanced public board meeting telephone conference. Thank you for taking the time to join us. By way of opening remarks, I would like to thank Albertans for the sacrifices they have made these months that helped limit the number of hospitalizations, including ICU visits. I would like to remind them to remain vigilant in preventing the spread of COVID-19. Although we are in phase 2 and relaunching the province, we are still in a pandemic that poses a serious health risk to the public. Please continue following public health guidelines. Don't let all of the hard work and sacrifice to date be for naught. As always, I would like to acknowledge the coordinated efforts of clinical and non-clinical teams throughout AHS that continue to protect Albertans while finding new ways to deliver the care and services that we rely upon. And as always, thank you. Thank you so much to our frontline staff. Now, before we receive the reports from the committees, I would like to address some administrative matters. We are continuing to physically distance and are participating by telephone conference today. When I ask for a vote on a motion, I will ask for those opposing or abstaining from it. For those who neither oppose nor abstain, I will take it that you are in favor of the motion. If there are none or a minority who either oppose or abstain, I will declare the motion carried. Now, I have someone move approval of the agenda that has been circulated.
I'll move. Heidi?
Thank you, Heidi. Will someone second the motion?
David Carpenter.
Thank you, David. Anyone opposed or abstaining? Thank you. The motion is carried. Based on the approved agenda, do any board members have a conflict of interest that they would like to declare at this time? I have a potential conflict of interest. One of the items that will be brought forward before the board for approval today pertains to restricted grant agreements, including funding for compensation for resident physicians. I have a family member who is a resident physician in Alberta and accordingly may receive some of the subject funding. Accordingly, there is an appearance of conflict of interest for me. It is unlikely that I would ever have to vote on this matter. Our bylaws state that the chair shall only vote when the vote is to break a tie. So I will not likely have to abstain in this meeting because I will not be called upon to vote. I'm making this disclosure in accordance with the requirements of our conflict of interest documents. Are there any other conflicts? Hearing none, we will move to the reports and motions of our board committees. Our first report is from the Community Engagement Committee. It will be presented by the committee's chair, Dr. Brenda Hemmelgarn. Brenda?
Thank you, David. The Community Engagement Committee met earlier today. The committee considered 2 items for board approval: the appointment of a member to the Sexual Orientation, Gender Identity and Expression Provincial Advisory Council, and the appointment of trustees to established foundations. The responsibility to appoint advisory council members and trustees to established foundations lies with the AHS board. The committee recommended the board approve the member and trustee appointees as reviewed by the committee. The board has considered such recommendations. We are very grateful for the commitment of our volunteers across the province. We value their work and appreciate their commitment to health care. As is our typical practice, given the number of appointments and renewals, the names of the member and trustees will not be read in this meeting but will be incorporated into the minutes of the meeting and posted publicly. Therefore, I move that the Alberta Health Services Board approve, number 1, the appointment of the member to the Sexual Orientation, Gender Identity and Expression Provincial Advisory Council for the term reviewed by the committee and the Alberta Health Services Board, and number 2, the appointment of trustees to Health Foundation for the terms reviewed by the committee and the Alberta Health Services Board. I so move.
Thank you, Brenda. Will someone second the motion?
Brian Vasjo, I'll second the motion.
Thank you, Brian. Any further discussion? Are there any opposed or abstaining? The motion is carried. Our next report is from the Finance Committee. It will be presented by David Carpenter, Chair of the Committee. David?
Thank you, Mr. Chair. The Finance Committee actually met today, and as Chair, I'm presenting two motions for approval today. The committee was asked to consider and recommend the Board delegate for restricted grant agreements relating to certain physician services and the provision of pharmaceuticals. With respect to physician services, I move the Alberta Health Services Board A, approve the terms and conditions of the Alberta Health Grant Agreements as recommended by the Finance Committee and reviewed by the Board, with such non-substantive changes that management of Alberta Health Services considers necessary or advisable. Firstly, relating to the operation and management of the on-call programs and provision of on-call services by physicians for the period April 1, 2020 to March 31st, 2021. And secondly, relating to the training and compensation of postgraduate medical education students who work in AHS facilities and provide clinical services as part of their educational training for the period July 1, 2020, June 30th, 2021, and B, delegate authority to the President and CEO to sign these agreements on behalf of AHS in accordance with Policy 1100, delegation of authority and establishment of controls for commitments. I so approve. I so move.
Thank you, David.
Okay.
Sorry, Stephen, are you seconding the motion?
I second the motion.
Thank you.
All right.
Thank you. I appreciate that. Any further discussion? Any opposed or abstentions? The motion is carried. David?
With respect to pharmaceutical costs, I move the Alberta Health Services Board A, approve the terms and conditions of the Alberta Health Grant Agreements as recommended by the Finance Committee and reviewed by the Board, with such non-substantive changes that management of Alberta Health Services considers necessary or advisable. Firstly, relating to the provision of cancer pharmaceuticals to outpatient cancer patients at no cost for the period April 1, 2020 to March 31, 2021. 2, relating to the provision of specialized high-cost drugs, short-term exceptional drug therapy, and rare disease drugs to eligible Albertans at no cost for the period April 1, 2020 to March 31, 2021, and B, delegate authority to the President and CEO to sign these agreements on behalf of AHS in accordance with Policy 1100, delegation of authority and establishment of controls for commitments. I so move.
Thank you, David. Will someone second the motion?
Hugh, I'll second.
Thank you, Hugh. Any further discussion? Any opposed or abstentions? The motion is carried. Thank you, everyone. We have reached the end of our agenda. I declare the business meeting adjourned. And thank you again to everyone joining us. Please wear masks in enclosed spaces, practice physical distancing, and stay healthy. Thank you.
Together, we do amazing things every day.